much for giving us the experience and the background that you've seen and what you're excited about moving into regenerative medicine and stem cell therapy. Could you tell us a little bit about the information or the misguided information we are presented with as far as stem cell therapy is concerned with regards to it being legal or illegal to practice in America? Do the stem cells come from fetuses? What kinds of stem cells do you use? Are these stem cells actually have efficacy? Are they dead, according to some people, the umbilical cord stem cells? Could you explain to us what actually is going on with stem cell therapy in America and how you practice it today?
Okay, yeah. If you look at stem cell therapy, really, we didn't know that we were doing stem cell therapy when we first performed the bone marrow transplant in the 1960s. But those were the first stem cell therapies. And later on, we realized, oh, there were stem cells in there. And people thought that the stem cells in the adult body only exist in the bone marrow. So that was the conception for a long time. But of course, we discovered embryonic stem cells, of course, we all came from one single cell, right? This miraculous, living, breathing body at one point was one cell. And what was in that one cell that has the capability to form a full human like you and me? So that was the science of stem cells. It's very exciting to see how these cells start to develop, divide, differentiate, start to form different shapes, because of, the fact that we were looking at embryonic stem cells. There are embryos that were destroyed, and these are from IVF, right? In vitro fertilization treatments, and these are leftover, fertilized eggs. So experiments were done on these. So, everybody knows that in the US, there's huge controversy about this. And some people think that you're destroying life. You are, it's the same as destroying a full human. So that but the destruction of more embryos was banned by Bush. But the research can still be continued because the embryonic stem cells are immortal. So you can keep multiplying them. So you can keep doing research on them. I mean, you're just not destroying any new embryos. So that was the start of controversy, right? Are we destroying embryos? And then in the US, doing treatments using embryonic stem cells, that's not allowed because it's not legal in the US. And another reason that I'm not a big proponent of it is that we don't have a good control over what kind of cells they become, because sometimes they can form tumors. And these are very specific tumors called teratomas. So they're kind of uncontrolled growth of human tissue. It could be hair, teeth, whatever, tendons, everything is all a clump of cells together. It's completely disorganized. And people probably have heard about people going overseas, getting stem cell treatments, embryonic stem cells injected into the back, and all of a sudden you got a tumor, you got a teratoma, you got a strange growth happening at the site of injection. So that is not what's used in the US. It has been used in some countries, but definitely not in the United States. So what happened in the United States is that initially people were using cells from the bone marrow. They realized, oh, there are hematopoietic stem cells in the bone marrow. And the bone marrow also help with bone healing. So a lot of orthopedic surgeons were using bone marrow, they were just putting bone marrow at the site of surgery, between the bones, and that helped promote bone healing. So that's great. So that's how it started. The bone marrow sector was the first kid on the block. And some, I'll say 15, 20 years ago, the fat-derived stem cells started to come on board. So these are from just our fat tissue. And it's really, when you look at how the cells are obtained, is not so much that we are getting stem cells from the fat itself. we're actually getting the cells from the blood vessels that are supplying the fat. So they're delivering nutrients, they're keeping the fat alive. But all along these blood vessels, there are these cells called mesenchymal stem cells. You can call them, parasites, that's before they become mesenchymal stem cells. They're all huddling over the blood vessels and sensing what's going on in the blood and sensing what's going on in the local environment. So they have this coordinating effect. They're always keeping a tab on what's going on in the blood and the local tissue. So these cells can be obtained through liposuction and can be extracted, and they can be used for all kinds of therapeutic purposes by injecting back into the body. So that's a little bit of the controversy, and there's a recent lawsuit. So a big lawsuit. The FDA was trying to shut down the clinic in Beverly Hills. Dr. Mark Berman and his colleague. But I think just last October, so that's October 2022, they won the lawsuit. The FDA says that you are using a drug, you're using it for all these purposes, you're changing the cells in some ways and you're injecting IV, whatever, different concerns that they have, that they're saying you're using these cells as a drug. But the Supreme Court, I think it's the California Supreme Court, basically says no. These are human tissue. They're not a drug. So they can provide the treatment without going through drug studies. Basically they said that's totally fine. You can't penalize them. So that's an interesting turn of event. So that's for the fat-derived. The umbilical cord birth tissue is younger, a little bit later than the fat-derived cells, but it's rapidly expanding. It's probably the fastest growing among different sectors of stem cells. There's a good reason for it, because one, these cells are readily available, right, from any birth. If it's a live, healthy birth, the mother can donate them. And the cells are actually a lot more potent, and they're more primitive compared to the cells of a person's own. So once a person, is aging, even if you're 25-year-old, you have aged quite a bit compared to the newborn baby. But these umbilical cord cells are younger than the cells in the babies. So the baby stem cells are not as powerful as the stem cells in the umbilical cord. Why? Because when the baby was forming, that's when the umbilical cord, the placenta, was forming, right? So all this was forming along with the fetus, and a lot of the cells were trapped in the umbilical cord. And the baby is, keep developing, but these cells retained a lot of the primitive features that only existed in the embryonic stem cells. So they're kind of in between the embryonic stem cells and the baby stem cells. So they're more potent, and they're also safer in the sense that they don't have the kind of cancer promoting properties that adult stem cells have. So there are tissue banks that produce these cells by extraction. So in the US, these tissue banks can extract these cells, and if they don't manipulate them and they grow, so that means they don't process them using either enzymes or chemicals, and they don't grow them to huge numbers, then they can provide the cells as a tissue transplant. And by the FDA's own guidelines, that is perfectly fine. You don't need to go through drug studies. You're providing a product that's a tissue transplant, no different than doing a blood transfusion, right? That's a tissue transplant, or a liver transplant, or kidney transplant. And those, there's no drug studies. These are transplantations that doctors are, have the privilege to perform. That's, that's what we're trained for. But if you start to use the cells in certain ways, then the FDA says that you may have to do drug studies. So that's, that's another layer of intricacy of whether or not cells are used in a fashion as a drug. and exactly what would that look like? What does that mean? If the cells were taken out of the body and it was processed mechanically, nothing was changed. They were carefully preserved by cryopreservation and they were woken up at the time of treatment. So it was no different than when it was really first obtained from the birth tissue and you're giving it to a person. Does that make a drug? So that's going to be a big debate. But by FDA standard, supposedly, they said if you're using the cells, these minimally manipulated cells, if you're using these cells the same way the cells was functioning in the tissue where you obtained it. So if it's the same function when you put back in the body, then is not you're not using a drug. It's a tissue transplant. So you don't need a drug study. So that's where everyone's so caught up. Are we using a drug? If we're using a drug, then we have to apply for IND study, and that's going to cost millions of dollars, and it's going to take years. So that's going to slow down the whole progress, and all these people are sick. They need help. So a lot of doctors are believing that they're performing tissue transplants, so they're giving these treatments. In Texas, that's stem cells treatment is considered legal. Charlie's Law. So there's a huge law that was passed, so that's considered legal. In California, it's legal as long as you post something, this notice on your door in the clinic, telling people that this is stem cell treatment, is not FDA approved treatment, and it's considered experimental in nature, and that you are aware of this status and you have talked with your primary care doctor. Then you can perform the treatment. So does that make it legal? Yes, that's what it means. You inform your patient and the patient agrees, and then you can perform the treatment. So that's kind of a long-winded answer about the legality and the history and whether or not there are life cells in them. It's pretty self-evident, and it makes me laugh that this myth still exists, that people were talking about how there's no life cells. I mean, how do you argue with a lie when I've seen third-party testing of our products showing that there are life cells? Although, as a company that provides stem cell products, you can't talk about life cells because somehow, if you talk about life cells and the metabolic activity of the cells, so you can do therapies with life cells. You just can't talk about the cells being alive, because if you talk about them being alive, then you're talking about the metabolic activity of the cells. So I don't really understand the logic, honestly, why if you talk about the cells being alive, that make it a drug. So it's just like completely like it's become lunacy, right? And I have people on social media, YouTube, attacking me for not providing data, but I can't even provide it. I can't even say the cells are alive. I mean, it's absolute insanity. It's like, what's the rationale? Why can't the cells be alive? Okay, so they can be alive. I just can't talk about them being alive. It's, how do you argue about this? And then there are people who don't like the fact that there are people who are doing umbilical cord stem cells, and they're attacking these companies, these clinics for doing these treatments, saying that there are no life cells, when there are, when they have been gone through third-party testing showing over 90% of viability. When these cells are produced in tissue banks in ISO 5, clean rooms, and going through very strict standards, and instead of just being processed in the doctor's office, when most doctors have no clean room and their process is very subjective. I'm not knocking these doctors, but there's less control in what these doctors produce in the clinic from your own body compared to what's been obtained in the tissue bank that has all the FDA inspections, regulations, and have very specific protocols and third-party testing. So it just has become a very crazy space. So that's kind of the short answer and the long answer, that there are life cells, but we can't talk about it, and who knows why.